100%.
He's got
And he's been.
been good. I checked it out.
Oh, I had never had
There's
one.
54.
Okay.
And there's equal amount of parents. It's pretty jam packed.
Yeah.
2,500 square feet.
Yeah, well, good. I saw your
Yeah.
photo and I was like, I need to go. I've never met you.
Yeah, just kidding. Come
So,
on.
and that's it.
It's like,
She
okay,
does this
well,
all day. It's not like they're questioning.
try to limit it.
Oh, no.
They're definitely over
Yeah,
there.
100%. I love the well now 4, but I gotta have. And they're like, yes. Okay. So we have.
Okay.
Because the goal is, the thing about also is it can, until the check communities, there's no size. Like the largest one we have is about 7. The largest bin, right, is one singular location with about 35.
You know, when like today's.
Yes, I believe it's still on talking not about next spring, but
Yeah.
the beginnings of that. So I'm bigger.
Well, yeah, just
Count a pack of those.
Yes.
And now that we got them.
She comes more than me.
Raise mass.
Oh, and it's.
Well.
Like, hey, you guys.
Yeah.
You know, I haven't looked at it yet. We're gonna get started until 6 o'clock.
Oh, I watched.
Yes, Steve, just 2, 3.
Awesome. And the feedback. Like, echo.
You don't go.
That like this would be more the 2
Yeah.
Go to skate park.
Yeah. Yeah.
But I thought it was
They must change their.
Yeah.
Based on that.
there.
So I hope we have. No, we haven't done
That's
it.
not-
Mine?
Oh, no.
He's special.
Yeah. When you hear them, it makes sense.
Yeah.
He makes you like, oh,
Well, it's like, guys, you wanna do some really fast? You live in the house, right? You know.
I was like, I didn't know.
He's like, yeah. He's like,
We'll get
absolutely not.
started here. It's 2 o'clock. We're gonna call the meeting to order, everybody.
Nice to meet you.
Yeah,
Uh,
I'm sure.
What was
that
that?
was
Yeah,
this one.
promises each other.
Yeah.
This is the Larimer Region 2 Opioid Abatement Council. Thank you. February 27th, we're getting started here at 2 p.m. So we're going to call the meeting to order. Thank you, everyone. We do have a quorum. We are only missing right now Commissioner Sheddick McNally. I know she'll be here, so she's probably just running a little behind, but do we have Councilmember Black online and can you hear us?
Yes, sir. Thank you. Glad to be here.
Thanks for being here. And then Mayor Pro Tem.
Yes, Chair, I'm here.
Wonderful. And Commissioner is just arriving, so we have a full quorum here. We'll move to public comment. Is there any public comment to make to the council? Hearing none, seeing none, we will close public comment. We will move to agenda item 3, which is approval of the January 23rd, 2025 meeting minutes. I will look to members of the council.
Mr. Chair, I move to approve the minutes as amended, as presented.
We have a motion. We have a second.
I'll
I'll second.
We got a motion in a couple seconds. Does anybody oppose that motion? Hearing none, the motion passes unanimously. Well, we're moving right along to financial, and Janelle will provide the financial report that was in the packet and we'll put on line here, and I'll turn it over to you, Janelle.
Hi, everyone. Today we'll be reviewing budget to actual financials for February 15th. Beginning with the inflows, you'll see under the budget column that $2.8 million in funding was requested for 2025. Of the 2.8 million, 2.55588 has been received to date. This leaves us with a little over 214,000 remaining to be received. All other budgeted inflows are rolled forward from prior years. And in the expenditure category, payment has been released to Harvest Farms for the second half of their 2024 grant agreement. And administrative expenses have been posted for the second half of 2024 as well. All expenditures listed in the unallocated column are available to be awarded. So that's the 2.9 million you see listed at the bottom right. And that's it. If there's no questions, we can move on.
Any question for Janelle? As always, wonderful job on financial, so easy to follow, thank you. We will move along to our big agenda item, grant administration. If you all recall from our last meeting and so previous meetings, we've been working from organizations and getting some proposals and working off a budget of the known money based upon staff recommendation on allocation of specific areas that the council has approved. What we did is split it up because it would have been a heck of a meeting if we tried to do all of them in one meeting. And we took the grants that are ending here at the end of this month and our 4 new ones that are proposed. And so then next month, you'll see the line there will go from CSU down to Harvest Farm Housing. So those will be for March. Anything to add, John, regarding grants? I know you've been working hard on this. No, okay. All right. So we've asked each of the proposed organizations to come out and provide us 10 minutes. We have plenty of time today because we're looking right through the agenda. 10 minutes overview and lead you for questions. We're also going to have the 2025 budget up there in the buckets so we can all see where money is allocated based upon the requests. So it should be able to be interactive for us all. So with that, any questions on the process? All right, partners is first to come on up and give us their proposal.
Hi, everyone. Thanks for having us back today. My name is Heather Vestgard. I'm the Executive Director of the Partners Organization. And I'm Shana Capalas. I am the Program Director at Partners. And we've had the chance to observe the group the last few months in your meetings. And I just want to thank you for your work and tell you it's an honor to watch great things happening due to your efforts. So we're here to tell you a little bit today about our organization, our proposal. You have seen us before, so I'll try not to repeat everything, but our mission is to empower youth and community members to achieve their full potential in life through mentoring and other prevention education services, as well as strategic partnership with the community. That's just a fun visual for you. Head to the next slide. So as a reminder from our previous presentation, we have a couple of different avenues in which we're doing prevention initiatives. So we have our youth mentoring, which includes community-based and school-based mentoring. And then we have our prevention education program. So the funding that we're requesting is for all of these programs as they all fit in that prevention bucket. Our youth mentoring follows the elements of effective practice. So it is research informed and evidence informed. We have, again, the community-based and school-based models in addition to activities that we offer to our waiting youth. One-on-one mentoring is our longest running program. It is also our highest dosage in that mentors are actually meeting individually with youth in long-term mentoring partnerships, minimum of 1 academic year, many of them lasting much longer. And so to connect adults a little bit for prevention, all the youth who are serving do face a variety of risk factors in their lives that could put them at further risk for substance use and abuse in addition to opioid abuse. And are therefore referred to us by mental health professionals in the community, other human service agencies, school counselors, that type of industry.
So our prevention program, we use the Brainwise curriculum. We work in a variety of schools in addition to other community groups in Northern Colorado, in Clear County. So that Brainwise curriculum, again, is evidence informed, and we have a variety of staff members who do that. You'll see in our proposal in a couple of minutes that we have requested funding for a new coordinator as well to continue expanding those services. We have had really good success with this over the last several years of implementing Brainwise, and we've had a lot of asks from other schools and community groups to do even more.
Also, we're always focused on strategic partnerships that are more adult-facing in nature. Adult behaviors and attitudes we know have a direct link to youth behaviors and attitudes. And so the more information we can get, accurate information, we can get into the hands of community members who are adults about substance use specific to youth, brain development, best practices in prevention, all of those kinds of things are really critical. We do that currently through two primary avenues, one being our No DUI, No Co-Steering Committee, which is a fascinating cross-sector coalition made up of everything from substance retailers to law enforcement, to mental health professionals, to public health professionals, really looking at this target population of older adolescents to very young adults being at very high risk for impaired driving incidents. So more focused on driving, but certainly the goal being to begin help connect the dots between substance use of all types and behaviors that we don't want to see the better.
So the total request that or funding amount that we've requested is $158,300 for the funding year. So it sounds like that's starting hopefully March 1st through that February 28th of next year. This is the amounts broken down. So we've updated it a little bit since we last presented to you to include those indirect costs and just kind of coordinate with what does make sense based off of starting a couple months into the year.
And really what you're looking at here is that all of our staff, we have a team of 18 people serving Northern Colorado. That includes parts of Weld County, but for this request, we're focused on Larimer County efforts. So about 15 folks. And all of those staff have to go through certain certifications for the Brainwise curriculum. They all come to us with human service professional backgrounds and educations. Keeping them trained, supporting their professional development, keeping them happy because they do the critical work of the organization, and making sure that we retain them is important. In addition, as Shana spoke to, we have got a list of schools and a list of youth waiting for services. And so adding that new position is really exciting for us with these dollars. Marketing dollars are important really because of those adult facing efforts. So we have a big public health campaign around educating the community about dangers of substance use for youth, and marketing costs money. Getting the word out there is expensive. So that's kind of what ties into this budget.
In addition to that, with the marketing dollars, our mentoring programs are reliant on adult volunteers. So we need to make sure that we can continue those efforts of marketing to reach more adult volunteers within the community for prevention.
This is where we get into the impact and breaking down some specific goals and objectives. You can see the number of youth that we anticipate serving through the 3 programs we just talked to you about, the number of schools served, activities that we're offering, the staff development that I talked about. And then we do measure our impact through youth survey. We are looking at things like youth perception around drugs and alcohol. We're looking at decision-making, their ability to use other adults in making good decisions and to bond with those adults to inform them. We look at a whole bunch of things, but these are our goals specific to this project.
And the reason that we have maintenance in with the wording is because we know that in prevention, it can be really hard to prove what you're doing, since we're trying to prove something that hasn't yet happened. So increase in maintenance has been shown to be the best indicator of success within prevention programs.
Just a little snapshot of the youth that we're serving at our organization. We track all of their demographic information. We track risk factors that are specific to the youth, and we tailor our programs and the work we do to best fit those risk criteria. So I don't love to look at the things our kids are doing, but it also drives us. And we much prefer to look at the potential they have and the outcomes that they gain through participation.
So in the application, we saw that there was a section asking about how do we improve access to those who may not otherwise have it. So we do not provide any fees for services within our programs, and that's where we partner with different funders like you all to be able to provide these services in addition to partnering with volunteers to provide services. We offer our programs in English and Spanish. We have a full-time bilingual and bicultural program coordinator who is able to work with our bicultural families in addition to supporting our other staff with these needs. So our paperwork, family newsletters, everything is in both languages. We also work with other community partners when we have families refer to our programs who speak languages outside of those two. We provide transportation for all of our activities and our mentoring times in addition to the prevention education. So we deliver our programs on site at schools in different community areas so that folks don't have to worry about transportation being a barrier.
And it's easy for adults to make decisions for youth. And our program really aims to have the youth themselves drive what their mentoring partnerships look like. We are getting feedback from them consistently throughout the mentoring process in line with the elements of effective practice. Case management support is the most critical piece of the program that we provide. The people are the program. In prevention education, we are doing the same thing. We are tailoring. Fortunately, the Brainwise curriculum is one that is allowed to be adapted per age, per number of sessions, and still be considered to be implemented with fidelity. And so we're really looking at individual schools, classes, the population of students that they're asking us to speak to, who are they, and modifying that according to the youth questions, the school feedback, what the kiddos are asking us for. What questions can we answer?
Questions? Yes.
Thank you for the presentation and thank you for your work. If we could go back a few slides to the original, kind of the goals and yeah, that one. So, so 158,000, support the high quality mentoring prevention. Is that for all 700 folks? Or is that just for helping increase the 60%?
So this is for all of our Larimer, well, for some of our Larimer County staff, those who have been written into the grant. So this 111,917 is for helping to support the salaries of our existing staff in addition to the new prevention education program coordinator. The 60% that you saw is what we strive for when we do our pre and post tests, and that is within the mentoring program. We also have a survey that we've worked with the Prevention Research Center at CSU with Nate to create, which will have different indicators for our prevention education program.
The 700 that you asked about is actually the number of youth served through the Prevention Ed Group program. We're going to serve 1,200 youth this year, region Northern Colorado wide. This proposal is specific to Larimer County.
Yeah, and I'm just trying to, I'm trying to be specific about what this grant does and the metrics for that money. So I'm just trying to understand where this is going. So what is the, if I might, Mr. Chair, what is the plan? Because, these are not ongoing funds and we're trying to get folks to understand they're not forever. And I know that the environment for a lot of people, including the county, is we're all seeing cuts.
Yep.
So what is the plan if you're going to hire additional staff and most people are cutting staff, and you're hiring an extra person, what is the plan? Realistically, because this isn't guaranteed, what is the plan to maintain any kind of increases in?
I appreciate the question and the transparency. It's actually something that we've gotten quite good at over the years at Partners. We have a very diverse revenue and we are used to new funders coming on as seed funders and appreciating time to be more strategic about diversifying for that position. So our goal is to never have somebody funded 100% by a funder for more than the first year of funding. So we just work with the other funders. Fortunately, there are a lot of organizations, both foundations, state level funders, and granted, all of that's But anyway, there are fortunately a lot of folks that care about behavioral health and that we over time just tie bits and pieces and percentages of staff to. And we've gotten pretty good at diversification and growth in spite of a pretty tricky time.
And what you'll see in there, so initially when we presented to you, we asked for the full funding amount for a position. What we've done instead, for that exact reason, is we wrote only a portion of that new position into this grant. And then we increase the percentages of our other staff because we don't want anyone funded at 100%. We've learned even that first year, we try not to do that.
Great, that's the reason my question after Commissioner Young, then I just have to ask.
Sure. You talked to many of the schools in Larimer County. Could you speak specifically about Estes Park? Are you in that? Are they on waiting list or?
That's a great question. We are in Estes Park with both of our mentoring programs, school-based included. School-based is in the elementary and middle school in Estes Park. Prevention education has not yet gone there. I think there's discussion around that. But we're definitely have a presence there and have for the last 15 years and have both mentoring programs well established in the community there and could go through assessing whether or not the curriculum-based group program is a good fit for that school district as well.
And to speak on that, is what barrier is causing that from not being implemented there?
I think capacity and really strategy around growth. Our Estes Park office is a single person office. It is more challenging geographically to implement a new program and to bring a new staff position in if we need to. So working with the individual program coordinator up there to balance her time between the 3 programs and know when it's time to pull the trigger. She's in great conversation with the school counselors out there, and where we have seen the demand so far has been in the mentoring programs. Estes Park is a more, as you all know, they're a smaller community. The folks who utilize our resources, they are very important too. So the mentoring programs, but it is a small number of youth, and Estes Park has never been able to establish its own sustainability. We are subsidizing that from almost every portion of our funding. So we just want to be really strategic there before we implement a new program.
Okay, thank you.
Thank you, Mr. Chair. I figured that was going to be Counselor Young's question. So, but I had the same question I was asking about geographic. So my question is, my next question, if we could talk about the program, and you're talking about alcohol and tobacco, but this is really about opioid abatement. And I wanted to know if there was anything about fentanyl and other kind of things in there.
So if we can scroll down to the next page. So ATOD is really alcohol, tobacco, and other drugs, so they're all included in that.
That's the scale.
So the scale includes questions around each of those things specifically, in addition to a variety of other drugs, including opiates. So there are 3 or 4 different questions per drug category, but they are lumped together just for fidelity of the scale and for the scale to work. And what we, sorry, go ahead.
Well, I just, this thing of my nightmares is just, youth counting their first time out to college or something.
Absolutely.
It's like, oh, I'll just take that one pill and try. And then I just, it's nightmares for me. So that's why I asked, because I know these other things lead to, more risky behaviors, but still, it's just, I hear stories again about someone who's never tried anything before going, thinking that, so I'm just curious. That's kind of always in the back of my mind.
Yeah, I appreciate that sentiment and that question. And also thanks for acknowledging that there is a pretty clear link in the research between experimentation with some of these other less dangerous substances that if you will, early in youth progressing to more dangerous substances. What's cool about the maintenance piece that Shannon was speaking to is that we know that youth who are already at risk for experimentation, maybe have already been experimenting or have a family history of experimenting. We know that their likelihood of heading down that same path is much higher than those who have never had that exposure. And so the fact that we consistently see and are able to measure maintenance of positive attitudes in spite of escalating risk is pretty exciting for the field of prevention. And that translates to preventing all types of things, including opiate use.
I really appreciate your answer. Thank you.
Just a follow-up, I forgot one question, if I may, Chair, is could you give us some examples of what the indirect costs, what's grouped in there that's paying the fee?
Yeah, you can speak more to the direct number because you worked with Kim on the budget on that, but, you know, we, spend the majority of our money, as we should, on programmatic implementation. So about 83 cents on the dollar goes directly to the program. Other costs that come into play, though, there is administration. There's everything from the operation director's time submitting grant reimbursements to the 70% grant contract and foundation funding requirements that are out there. There's operational costs associated with the building, with technology to let our staff do their jobs. So there's a whole lot of administrative work that has to go into supporting that team of program people who we're serving. So those are the types of things.
What's the total percentage of the indirect?
Can you scroll to that again? It was, I believe that we likely use your allowance for it. So, is
Is it
that?
10% that you
I
all
think
put?
it's- It might be, although it might be 15 if that was
Might
the
be
allowance.
15. Did you
Yeah.
allow 15?
Yeah, so we're really, trying to utilize what folks are offering for those indirect costs so that we are able to secure funding to support the longevity of those positions and diversify those resources.
I have just a quick, I appreciate your working with Dr. Riggs over at CSU Office of Prevention. That's a great connection. Also, I suggest with your marketing, working with Rise Above, because they're already in that space. And so maybe there's some areas you can complement each other.
We know both of those folks very well. So
And
it's
it's
great.
a connect effect.
All right. Any other questions? Thank you very much.
Thank you so much. We appreciate you.
So we can pop up the
Question is, what do we allow for direct costs? Is it 20%? John, do you know?
Policy is 20% cap.
Okay.
thank you, John.
And we can give you a specific percentage. I can pull up the application and look exactly what we did. It's 20. Okay, great.
So we'll pop up the budget board, I don't know, for lack of a better word. You go. So we've got the organizations, we've got the ask and then the total amount, is that right? John, on the far right?
Yep, so and we're kind of just a tad showing, we're missing yeah, there we go. So we can see row 2. Where you can see the G, the letters. There they are, the different buckets. So column S is part of the prevention group, which is what G is. And there's different types of prevention and that sort of thing. And so they're at 158, 300 in the request. There's also a preliminary budget I put over to the right. This is what everybody asked without consideration for buckets. So you can see they asked what the preliminary amount that we use the base. And so they're different. That's exactly what we expected from them. And right now there's a $10 underuse, but we're anticipating when we get to Colorado Health Network that, they asked for a little bit less than what we originally expected by $137.
So partners is coming in right at where discussion was in previous months, so anybody want to entertain a motion to move forward with accepting partners?
I'd like to make that motion to move forward with accepting that proposal of our partners under the
We got a motion and a second. Does anybody oppose the motion? Seeing none, that passes unanimously, and we're excited to see the work from partners.
Congratulations.
Congratulations. Yeah. All right, moving along, Lighthouse faith-based sober living.
It's just really large.
Before we start, I just wanted to let the council know, as you know, I had asked you all if it was okay if Dr. Leslie Brooks, medical director, and subject matter expertise in this, nationally, statewide, just amazing resource. We're very lucky that are here in Lamar County. I've asked, you all had agreed that she could be here as a resource. So she's here, and I want to just acknowledge her, thank her for being here. I do think that she's here to answer questions if we want to ask about, subject matter expertise about substance abuse and things. I mean, she has all things, and I really value her expertise. So I just wanted to highlight that and just thank her for being here. I just want to make sure you all know here, she's here also as a resource, just like Jessica and our lived experience and everyone. I just want to make sure we know she's here for our help too. So thanks.
And welcome.
Yes.
All right.
Hi, everybody. My name is Jennifer. I am the program specialist at Lighthouse. I am also 5 years in recovery from an opiate addiction, so I'm super excited to be the one who gets to present to you guys. Next slide, please. So a little bit about Lighthouse and our scope of work. We provide recovery housing that integrates medication with other support services. For the past 14 years, we've housed over 1,600 people. And we also offer comprehensive wraparound services, including in-house case management, peer support, recovery meetings, and social activities. And I'm super excited to say that we are now MAT friendly, allowing for the long-term use of MAT medications. We started doing that right on January, but we started in mid-December instead. And it's been amazing, so super excited about that. And my favorite part about Lighthouse is the family-like atmosphere. People just don't have outside support systems, and we become that family and that support for our residents. Next slide, please. There's a lot of info, so I'm just going to really quickly go over the main points. Our first objective is to enhance intake and case management staff. We would like to hire a new full-time intake specialist and community resource navigator, and then also increase my hours by 13%. Next slide, please. This new staffing will allow us to do more tailored services. We want to do comprehensive needs assessments when people move in. We'd like to offer MAT education and referrals to every resident when they come into the program. We also like to do more targeted support, like every resident getting help meeting those needs with ID, job search, resume. Right now, it's kind of when we have the time. Some residents get that. We'd like every resident to get that support. And we'd like to improve the economic self-sufficiency of our residents, track employment benchmarks. We're hoping for 25% of our residents to be employed at 30 days, 50% at 60 days, and 75% in 90 days in our program. The second objective is to increase resources, support, and access to recovery housing that integrates medication. We'd like to offer 20 additional first aid scholarships, as well as 50 additional scholarships that can be used as needed for residents throughout the term of our program. We also have a pretty big need for more medication lockers. We started our MAT program with 8 lockers, and we thought that would last us well, and those filled out within like a month. So we need to at least double that. And then provide housing resources, including utilities, intake baskets, cleaning supplies, and paper products. Next slide, please. This will allow us to give 20 more people access to our program that would have otherwise been denied because of the inability to pay the first month's fees, as well as we're hoping that this will allow us to not have to remove anyone from our program because of payment issues. Next slide, please. Third objective is just to do a little bit of improvement to our sober living. We have been around for 14 years. Things get really boring. We need new mattresses, desks, dressers, wardrobes for residents. And then we'd also like to install a urinal and sink into our new office. Next slide. Yeah, and we just would like to survey residents with that, hoping for at least 75% positive ratings on the improvements. Total budget first is $155,625. That's $50,625 in staffing and $105,000 for housing resources. And I think that's $125 per hour. Pretty close. A little bit about the populations and communities reached. The I'm very excited to see we've been reaching a lot more people that are affected with opiate use disorder. Last year, close to 7 to 10% of our residents listed opiates as their drug of choice. But now with our new MAP policy, it's closer to 37% of our current residents that are overcoming some kind of opiate addiction. And I expect that to just keep climbing. The word's been getting out that we're allowing these medications. We're having a lot more people come in that are overcoming opiate addictions. And also people that are disproportionately impacted by opiate addiction, including justice-involved individuals, 76%, 85% of our residents were homeless, people from the Lighthouse, 100% are low income. And we have a very diverse community right now. 23% identify as Black or African American, and 27% as Hispanic. So we try to provide really culturally responsive and person-centered care. I'm personally trained in DEIJ and cultural competency, and think of that as a lifelong process. I'm going to try to lead the charge at Lighthouse with being culturally competent, and this will also help us with our direct outreach to incarcerated individuals. We use Zoom interviews. We work with Summit Stone. We work with NCHA a lot lately, and their folks inside the jails, case managers, so that we can do interviews with folks while they're still in jail, get them accepted, and they can come straight to us after they're released. Next slide, please. See, incorporating the voices of affected individuals. We conduct focus groups with our communities of color to make sure we're meeting their needs. We also just basically refine our program based on what our participants need and what they want. Peer support, staff, leadership, we all have lived experience. And we commonly get together with our residents and just adjust as we go to make sure we're meeting their needs. Next slide, please. That's it. Thank you. Sorry, I'm a little nervous.
Questions, Commissioner?
I just want to be clarify, make sure I understand. It's about $14,000 for the kind of capital improvements or the equipment between the mattresses and the medication locker.
I would have to look. I think the medication locker is like 500.
And then the replacement of mattresses is about 10,000. That's
For furniture, it's 10. Yeah, for furniture, it's 10.
Okay.
It's 500 for the lockers, and then it's 2,500 for the urinals.
Okay. And then if I could just put Mr. Chair, how many I was in a presentation as the county, we were talking with our community justice alternatives program and talking a lot about some of these processes and some of the outcomes. Because what we do here in Larimer County at community justice alternatives, but just in general, a lot of things we're doing are very unique. There is a big need for women.
Yes.
I know we had specified in another one about women. It seems like there's really a need for women. So can you share with me percentages about women, and then is there a way to kind of, I don't mean it really takes on who's there, but is there kind of push to maybe support more women like yourself? But
I mean,
congratulations on your 5 years.
We're actually, Lighthouse is run right now by 3 women. Everybody that's on staff is a woman and is in recovery. Lighthouse just started that way, and we've never had the funding to be able to open up a woman's house, but that would be our largest goal, is to get the funding to open a women's house. I mean, that's what we've been wanting to do forever. We just haven't been able to do it, so.
That's great, but I'm wondering if you guys, how is your numbers looking? Do you have an opportunity to maybe try to lean towards having more women, helping more women?
We only have men. Most sober livings are
either one
or the other. Yeah, so.
Okay, thank you.
It causes a lot of issues when you combine men and women in the same house. So.
Okay, thank you. I
Yeah.
appreciate you clarifying that. Thank you.
Thank you for your presentation. I do have a couple good list questions. Since you're not, so correct me if I'm not wrong, you're not increasing your capacity, but you're wanting to increase the scholarship amount, right?
Right.
So the amount of people isn't going to be increasing, you're just trying to help supplement that.
Exactly. We have a pretty big need for that. We have 20 scholarships for the year right now, and we've already used almost all of those, and it's only a couple of months into the year. So, yeah, we'd like to be able to offer more first months, and the other ones are just it takes people a while to get a job, to just get things settled, and we don't want to have to remove anybody from the program because they can't pay. So at any point, we'd like to be able to support them with a scholarship.
And how many have you had to remove in the past?
Oh, gosh, we let people go pretty far, but we have to get to a point where we can't. I mean, within a year, maybe 5 people, but we usually do payment plans and work with people as best we can.
Okay, and, let's see, how do you feel you can sustain the level of services if you don't have these funds? Because this, as Commissioner mentioned with the other presentation, that are going to, you know, these funds aren't guaranteed and who knows what next year will be. And, I quite frankly have a little concern with, you know, if you don't have the abilities to do your utilities and buy your cleaning products and the blankets. It seems there's a lot of things in here that are services that aren't going to, that should maybe be provided by, you know, other financial means. Can you speak on that?
Yeah, so about a year and a half ago, we changed locations. And we had a really low cost lease for 14 years and we could easily afford all of these things. But with that move, it took some of our reserves. We're still on track to continue being able to afford our location, but we don't want to have to increase prices for our residents is basically what it comes down to. They pay program fees. We like to keep ours at the lowest cost in the area, which is what we try to do and try to stay at. So all of these things are included in their time in our program. We don't want to have to raise the cost of living for our residents, which is something we might have to do if we don't continue doing grant funding and getting all these basic things covered.
And on the intake specialist, since you haven't had one, who has been doing that work?
I do the applications and I do most of it. We also had we have 3 employees right now. We had 5. We had someone that recently left, and then we also laid off our executive director, which is another thing for funds so that we can be sustainable. Basically the people that are doing the most work are the people that are staying in the program and working there. But I've been balancing a lot and we'd like to just do more individual support services for just everybody that comes in. We did have one person, like I said, that left kind of without any notice after 3 years of being there. So it'd be filling some of that, but kind of a more tailored position of things that we know that we need at the time.
Trustee Black, do you have your hand up?
Yes, sir. Mr. Chair, appreciate that. I just had I guess an odd question. So this is an all-male facility, but it's just female staff. Did I hear you correctly there?
Yeah, we're all female staff right now. We do have men that are in the program that are leadership, so they are, I guess, kind of part of staff. They're not technically staff, but they get scholarships. They do leadership roles. They do, I guess, what we call security at the house at night. Our old staff member lived in-house and he's the one that left, so we kind of filled that role with some of our residents that have been with us for a long time.
Okay, thank you. And let me ask you this. I missed your first name. What was your first name?
Jennifer.
Jennifer, thank you. So I've been thinking a lot about housing and housing costs and taking care of those that take care of us. So is it hard to keep staff or are you losing staff because of the annual pay rate? Because I'm looking at that annual pay rate and I think you'd be hard pressed if you didn't have another income to look for something affordable to actually own in our area. So is the pay rate salary an issue for staff?
It's not at the moment because the people we have love their job. The people we have right now have been there for 6, 10, and I've been there for 2 years. So we stay because we love it, but we do realize that if we can't start, increasing that we're not gonna be able to get people to stay.
Okay. Because again, our people are our programs. So I just want to also congratulate you in your recovery and with your staff. Thanks so much.
Any other questions? Thank you, Jennifer.
Thank you.
Look back up our. So John, what they were allocated or did they come in at the same?
They asked for $125 less than or more than we expected, 125. Yeah.
Didn't know, again, I'm concerned with the amount of money in the, categories of costs that we can only pick up is 20%.
Okay.
And,
Lighthouse is not asking for any indirect if you look at their budget.
right, but isn't I mean, okay, so what classifies something indirect?
Well, that's a big debatable discussion. It does in effect include utilities and IT and your janitorial services and all that stuff. Yes. But I would say that's part of, but if you're providing housing, that is part of the housing cost. So I'd argue that is direct. You know, we were talking about, I think there was a question about mattresses, things like that. And normally we don't yes, those have long-term, but normally if they're not more than 5,000, we don't usually consider that capital
Can
equipment.
we bring that chart back up?
That is over 5,000.
Yeah. Well,
Individually, a mattress doesn't cost 5,000.
Okay.
If each mattress costs 5,000, then we'd be in trouble.
Okay, sorry, I was eating.
Yes, not collectively. Yeah.
What do you, still we all hear you?
Oh, she was asking about indirects. I'm like, well, I mean, if it's not directly related to the program and it's for the whole organization and you can't directly allocate it to a program, then you would consider it an administrative cost. But since their program and their organization, they're kind of one and the same.
Okay.
They could cut out those line items and just put an indirect cost of 20% and still cover all those things. It's just a matter of how you're looking at it.
Yeah.
But they're calling out more specifically about what it's actually funding instead of giving you a.
I
But I
actually
think it is over
appreciate the
20.
details, sorry.
Yeah, no, I agree, but I think it is over 20, and that's what I'm concerned with. Because if you do the linens and the utilities and the cleaning, I think just those three are over, or the replacement of mattresses, yeah. I mean, the medication, I don't, that's fine, the sink, the urinal. It was just those items just have some cause of concern.
Yes, good.
Only thing I would say to that is I agree with what John said about, especially like the utility, the cost of housing really should encompass utilities, because that's what you have to pay, and I really appreciate their wanting to keep the cost to the residents stable, because it's so hard to find housing that you can afford in Fort Collins, and this, especially someone in recovery, I think that's a basic part of what they're offering. So I would just, I think in this case, I think it does fall under direct costs. Good point.
Thanks for the conversation.
No, it's great, I appreciate it, yes.
But I think it is an important conversation, and hopefully grantees are listening, because we are paying attention to direct costs. But housing has been a priority, because it's so important and was reinforced to me yesterday. But I do think they need to understand we're watching these, and this is kind of what we have to be careful with. But I do appreciate transparency.
Yes,
So,
I love that, yeah.
so, but I agree, I appreciate bringing the question and having this dialogue, because I do think it is important for us to really, because I thought about the same thing. I think it was about 7,000 over, so yeah, so anyway, I appreciate you bringing that up.
All right. Any further conversation regarding Lighthouse? They're under B.2, which is recovery treatment supported housing. And John, you said they did go over $125.
Yeah,
Is that an issue?
No. no, we're gonna, when we're done, I think we're gonna have a little,
Okay.
some wiggle room for stuff that small. Yeah.
What do folks like to do next with Lighthouse?
If I could, where we have flexibility is there's a number of green in that same column, 162,000 that hasn't been allocated, or we don't know who that's gonna go to. I think $125 to cover that.
Yeah, And I also wanna, I know that budget's there, but I'd like to wait to not even talk about, I mean, I know we could for 125, but I really like to not even think about touching that until we get to the end of all the presentations, so, and have that conversation, so.
So with the, you want to approve it based on removing $125 because it got over?
I think 125 is, 100 is reasonable, but I think it was like 1,000, 2,000.
I agree.
Yeah.
Sure.
Yeah.
I'll make the motion to approve the request.
I'll second.
We have a motion and a second for the request from Lighthouse. Any further conversation? Does anybody oppose the motion? Seeing none, that passes unanimously. Congratulations, Lighthouse. Great conversation, great questions. Now Red Point Center.
Thank you for having me again today. I'm gonna just touch on some newer information that's kind of come to light since hearing from the committee more and the lack of resources for certain demographics. If you want to go ahead and scroll down. So we are a clinical facility. We're dual licensed in primary mental health as well as substance abuse, joint commissioned and BHA accredited. If you scroll up, something that I noticed when filling out was the interest of individuals in recovery providing services. If you scroll up a little more to our leadership team. So our leadership team is comprised of 4 of us, all in recovery, 3 of which are women. Donnie and Dr. Honor Ashbaugh are 2 of our owners, so we're locally owned and operated. Honor oversees all of the MAT treatment as well as mental health care for clients. And Donnie specifically is in recovery from opioid addiction. So if you want to go ahead and scroll down. We are requesting $150,000, which would be allocated to direct client care. So that would go strictly to clinical services provided to individuals of Larimer County. We also have a virtual program which would be accessible for those in Estes Park. It was a little hard coming up with the budget because each client will be assessed upon entry as to what appropriate level of care would be for them, whether that would be full day treatment or our intensive outpatient program, which is 3 either mornings or evenings a week. And the length of stay varies for our clients. We don't do a set length of time. We base it on their treatment goals and their clinical progression. So for some of our in-network providers, clients have stayed with us a year. That probably won't be the case for many of these individuals, but the longer we can keep them in treatment, yields the highest results for long-term recovery. We also have an alumni program, which is accessible to every client when they first walk in the door, and they can attend for free forever. If you want to go ahead and scroll down. For those of you who might not be familiar with clinical terminology, PHP is partial hospitalization programming, which is full day treatment. Lower client need would be IOP, which is going to be 9 hours of group MAT treatment. All of the medication stuff is not the prescriptions we don't administer, but Dr. Ashbaugh does administer Vivitrol or other, sorry, why am I blanking? Suboxone, thank you. To clients, specifically opioid clients. Outpatient level of care is a really important level of care as clients taper. However, it's not an entry level of care that we offer. You have to graduate into that level of care. I think this is some images from our specifically Fort Collins location, which is on South College Ave. And I think I'll just open it up for questions now.
Question, yes.
Yeah, thank you. Just so I can understand, so is it exactly 10 people or is the equivalent? Okay, that's
No,
right.
yeah, that was kind of like a summary of what it would be if everyone entered at a specific level of care. Also, we treat women, we treat pregnant women. And anyone is welcome regardless of, we're not religious affiliated. So something that stood out to me before is a lot of funding has gone to male or religious organizations, which can be not welcoming to all demographics. So our only exclusionary criteria is clinical. Everyone is welcome to seek services with us.
And you did say break, women.
Yes.
Yes, great. Okay.
Yes.
Other questions?
Are you to Larimer County specific? What if somebody comes out from another county or what have you?
Well, this money, we have 4 locations, so this money would be specific to individuals in Larimer County. But if someone was in a more rural area, we would support them in our virtual IOP, which PHP wouldn't be accessible to them. But considering virtual IOPs, ours is pretty robust. And outside of that, it would be anyone in Larimer County, and we would facilitate where they receive services based on what's most appropriate for their lifestyle.
Counselor Black, I see your hand up.
Thank you, Mr. Chair. Thank you for that presentation. So are you guys giving any free or sliding scale or scholarships for services?
We do. We also accept Medicaid. So we are in network with Ray One, which would be for Larimer County, as well as our Glenwood Springs facility. So this would be specific to clients that either had a lapse in insurance, didn't qualify for Medicaid for some reason, but we would have a vetting process as far as similar to, we work with Boulder County and we have a vetting process as far as like financial disclosure. The admissions process just looks a little different for clients that would have access to the grant.
Okay.
So our scholarship is kind of an informal process because we are small. So we work with people depending on what they need. Unfortunately, with insurance, we can't really work with deductibles or out of pocket. But we try to do what we can at our sober living environment, which is in Longmont and Glenwood Springs, or where we can with services.
Okay, thank you.
Mm-hmm.
Other questions? Thank you.
Yeah, thank you.
All right.
And I don't mean to be rude, but I have to get my children, so I will be jetting out after you.
Oh, no, we understand. Thank you for that. Okay, so Red Point is also under recovery treatment supportive housing, B2. And John, did they come in at
They did. Over on the right, you can see
exactly it?
they came in exactly what we expected. And just also under column B, right now, we're under budget by 40,000 without even touching the 162 right now.
Okay, further conversation.
I think, I like that, this will help treat pregnant women, that they, I like that we have some organizations that are not faith-based. I adore faith-based organizations that do a lot of work, but I also think it's important to have that. I've heard that from some folks recently. And in the climate we're in, it seems like that is making people a little more uncomfortable sometimes. So I think this is the one thing that we've had where we've had an opportunity to help pregnant women. So I like this project. If this is an opportunity or this increased service, I know there are some things happening, but.
No, I agree.
So I would like to make a motion to, before you do that,
And just comment. Now, we had a bucket for that we were able to fill.
we put that back into, I think we put that into the equity.
Okay, I just didn't know.
That's a good. you can
If
raise
it would
yeah.
be advantageous that since we have one that fits in there, if it would help that category to allow more funding, you know. I didn't know if we needed to go ahead and separate it now that we have somebody in that.
Yes.
I didn't hear that they were 100% in that
Yeah.
category, so I would.
They weren't.
Right, so and I don't know if they can
Right.
estimate how much they would
Yeah.
need,
It's
so.
a challenge.
I think that would be, but I pointed that out because I would say we couldn't find anything 100%, but this might I know that was a priority for you and for all of us, but I just thought I would flag that that was at least an option that we were wanting to, when we original conversations, we wanted to have something there. So I wanted to just highlight this as an opportunity to at least do that. So I was wondering, some people, it seems like still a small number, but it just highlights the cost of what this costs. And so so I was wondering if I might ask a question of Dr. Brooks at this point. We're starting to see some in-house medically assisted treatment. These are not acute, or these are not acute cases, these are the next phase.
People to community.
Yeah. And so that is, that's overseen by the physician that's overseeing that medical director who has that.
So I'm sorry.
No, go ahead.
What is the question?
Well, I'm just wondering, with that kind of programming, the housing connected with the medically assisted treatment or with this programming, what,
Is this housing?
well, this, I thought there was, or this treatment, the other one with the housing, I was connected with the housing, with that having it there, and then this one, that is a fairly successful treatment modality or place, and
It is evidence-based to get people medication where it makes sense for them, in-home inductions, in-clinic inductions, in bedded care, it is evidence-based to make sure that people who want medication for whom it's medically appropriate get it where it makes sense for them. So, but this is not how.
no, that's not
this is
happening,
IOP
but
and
I was
PHP.
thinking, I was trying to tie it to the first one, because we don't have too many where I know the housing had that. Inside.
Oh,
the
has
housing.
that medication
Yeah.
available on site.
So I was thinking, I was gonna ask you that at the previous one too, but it's kind of was late, so I thought I'd tie it together, so.
I would also offer that IOP and PHP are also really much needed services that don't exist in the numbers that they should.
Okay, that's a great,
Great to know.
great to know. I'm so glad you're here.
Well, and I guess the question that I would maybe have is how, what is the barrier that they only have 10? Is it their location, is it their staff?
Well, to clarify, it wasn't just for 10 total, it was an equivalent, so a number. So
Right.
there's a- Yeah,
Yeah, but how can,
think of the cost, right?
how would they have ability to increase that? I mean, they're only asking
Oh.
150,000 if the need, obviously the need is there. Am I able to respond?
Yes, please.
So a couple here. Oh, yeah, okay.
My thought around that was to, I'll be honest, I haven't done this a lot. So I wanted to be relatively conservative and not over ask, to make sure there was enough to go around to various demographics and other places that might also need the funding. We will use this and we could certainly use more. And if the committee would like to allocate a specific amount to women, to in other marginalized individuals, then we would be happy to utilize the money specific to those things. I just wouldn't want any of it to go to waste. Then again, if I came back and presented, we could reallocate at that time if a certain pot was in 6 months being done. The other thing is sober livings, I don't believe are administering that medication. They allow clients to be on it.
Okay. So are you looking to?
Well, I'd like to direct that because I'm not, so you're allowing them to be on.
No, we administer, because
You
we
administer.
have a medical director. Sober livings that include MAT treatment in general, they allow individuals to be on Suboxone or other medications which can be controversial at a sober living environment, but I am not aware of any sober living personally that is administering that medication on site.
So that's a big need. How difficult would it be for you and staff to have a couple pots, for these women, pregnant women, things like that?
And LGBTQIA
Yeah, right,
plus
yeah,
populations. It wouldn't be difficult. You know, our admissions is, everything is tracked. We were a close team. We work together. We could certainly do that, or I could bring back the data, but I just wouldn't want to have this money go to individuals that already have access in a lot of other areas. So, I mean, I would say on average, half of our, you know, demographic is women. Pregnant women, we don't treat as frequently. I can think of two that we have treated. And then one of our employees was one of them. She was an opioid in addiction when she came to us, and now he's 6 and she works for us. So it is more rare, though. I'll be upfront with that.
Got an idea.
Yeah, it's not an exclusionary criteria.
What?
It's not an exclusionary criteria.
It is not. Private.
Okay, cool. So I have an idea. So, what's on the table is what's presented, right, for the budget. But maybe since we have another allocation coming up, when we're looking at the other ones, if we can squeeze in, if they want to come back, if we want to ask them to go for another equity pot between women, pregnant women, and they'll allocate a little bit, but, I'm sorry. So, yes, have that and have them present, with a pot of funding for specific, that could be the equity piece. So in addition to this, conservatively, but to allow them to have come forward with because right now that's not in the budget, the amendments and agreements, and we want to have, if they're willing to do that, we need to have that, tell that. So my suggestion would maybe to invite them to come back with that presentation.
And rural, because Estes Park really doesn't have clinical access for this. So we could certainly do that.
So the motion on the table, I think we had a second. I know you had.
We had
I gotta make a motion.
No, you started.
Should start?
So my motion is like to go ahead and approve this allocation for Red Point and encourage them to come back to apply for a second specific equity pot for those 3 groups.
Got a motion, is there a second?
I have a second.
We have a motion and a second, which included encouragement to come back and apply for the funding that is in the effectiveness phase as well. All right, any further conversation? Seeing none, anybody opposed? That motion has passed unanimously. I will just kind of. Just a time check, we're at 3:05, we've got 3 more, so we're gonna have Butler Institute come up. While Butler's coming up, just a reminder, we've been doing this work, because the Butler it was tied to the Northern Colorado Health Alliance grant. We've since pulled that out, so it's separate, and here's Butler to present what their plan. So,
And I just say, remember that a lot of the things and agreements and our metrics is already embedded in from the work that they've already done. And so we approve that, and I think we're way beyond ahead of a lot of other groups. I'm really thankful and proud for all of that.
Oh, thank you. Yeah, thanks. Good afternoon. Thank you for having us. I'm Meredith Silverstein. I'm the Director of Behavioral Health Initiatives at the Butler Institute for Families, University of Denver. And I'm Kavitha Kailasam. I'm a Senior Program Associate at Butler, and I live and work here in Fort Collins. Fort Collins. So just a little bit of background about the Butler Institute. We've been working in the areas of tribal initiatives, behavioral health, early childhood education, and child welfare for over 25 years. Just to give you some idea of our scope, we manage more than $9 million in grants and contracts annually. I think since 2011, we've managed over $80 million in grants and contracts. We have projects in 48 states, or have had projects who have national reach. And we've been really privileged over nearly 10 years to be working with some health partners, NCHA, Larimer County Sheriff's Office. And so we are really proud to be a part of the community here. Next slide. Okay, so what do we do? We provide program evaluation, so measuring outcomes, measuring implementation, strategic planning, training, coaching and facilitation for all sorts of capacity building projects. Again, we have many local partnerships, which we're proud of. And we provided the program evaluation implementation support for four SAMHSA grants that have been held by Larimer County organizations. So our purpose through this proposal is to really support both the ROAC in its operations and functioning, and then also the ROAC grantees. So you'll see that we have two main goals. One is part of what we already started working on last year when we had a subcontract through NCHA. We were supporting an epidemiological outcomes working group that provided recommendations to the ROAC. I think it was referenced earlier that we supported the development of goals and principles for the ROAC just at the end of last year that were then presented to this group for approval. So that's one part of what we are aiming to do. And then the other part would be to provide technical assistance directly to grantees. So grantees that perhaps don't have in-house evaluation support and would like to take advantage of this opportunity, we're offering up to 3 technical assistance and coaching sessions for anyone that's funded through the ROAC. So if you can, so the next couple of slides just talk a little bit more specifically about what we would be doing. So in that first goal, we would be helping to kind of reevaluate that working group that is supporting recommendations for the ROAC and make sure we have an inclusive group and maybe reestablish the membership and do more recruitment, facilitate those meetings, consider topics as needed for the ROAC. Including, various procedures and decision-making structures. We have a research team that will support an environmental scan of other best practices of what's going on, including using the Johns Hopkins OSPRI measures. We are connected to other ROACs across the state as well through other partnerships. And so really getting some insights into how this is functioning in other parts of the state and bringing back recommendations here. And then, like I said, the second goal to provide support to grantees of ROAC. We have a really robust evaluation staff as well as a coaching team. So it would be bridging those resources to support grantees. And this last year, we provided technical assistance to 3 grantees as kind of on a as requested, as needed basis. And I really enjoyed that. Personally, I think it was really, hopefully they got some benefit out of it as well. So yeah, that's our proposal.
Question, yes.
If you could go back down the slides a little bit about the distinct group for objectives, identify recruiting, a recruit working group distinct from ROAC. What is the plan for that distinct group and who's on that, and how would you recruit? And would you have someone that, again, like we had this last time, a liaison from the ROAC,
Yes.
so that make sure. The reason I'm asking is conflict of interest. If we have people who are going to be looking to apply for grantees or former, I'm trying to think about that going forward. So I'm wondering about that group and how you recruit and who's on that.
I think we would like to, kind of just start off this new year, this new funding year, kind of resetting what that group is, what are the perspectives we want represented in that group, starting with that kind of analysis, and then seeking input from the ROAC and other subject matter experts locally around who could fill those spaces to provide that input. One, I think we mentioned it in our application, but one voice that's missing in that group is from folks with lived experience or impacted individuals. And so we want to be more intentional about that in resetting that group.
Yeah, I think that'd be really important to make sure it's with the lived experience that it's someone who has ability to have that time, and also that we would have to talk about, would we give them a stipend for their lived experiences? We have that policy, and then also making sure what groups they're associated with, that they're not influencing. So I'm just saying, because we're trying to, it's just, I'm talking budgets and stuff all the time right now. And then who's just influencing is just kind of getting really kind of a 100 Games thing right now. So that's the reason I'm asking. I hate to say that, but it's true.
Well,
Okay, but it is DC tomorrow, so it's even gonna be more 100 Games. So
it is true, and we want to make sure that the group that is at the table is as inclusive and representative as possible and as equitable as it could be. Right now we have really good representation from Garmo County Public Health. And we'd love to like continue that because that perspective is invaluable. But as we think about that group that's been meeting, like who else needs to be here? And then how can we engage with those other stakeholders in a way that does not compromise or create any conflicts of interest? So that's going to be really critical. And that, you know, that brain power is part of the work, right? And it needs to be really thoughtful. So yeah, we definitely hear you. Thank you.
No, I think you guys did a great job. I'm just been thinking about this more lately, so.
Yeah, thank you.
Just a quick question, how would this offer go out to the grantees of you know, what you're talking about, what 3 times or whatever? How do they know about that and how would you get that word out?
Yeah, so we would get a list of the grantees from the ROAC. And last year, we just sent an email out. We sent a couple emails out. I think Jared, because what we were concerned about was they'll get an email that says Butler, you know, University of Denver, click, delete, right? So we had Jared Olson provide some like entree for us, and that I think worked really well. So we can continue to do that again. And the folks in this room, if we are funded, would also know that we're available for support. Yeah.
And maybe through the contract process, we could also make sure that they're aware, you know, somehow. I think that's a valuable
Thank you.
piece of it too. That's all I have.
Well, I think this is really important. I'm glad that we took this out and put it under the ROAC, and I think this is a really important tool. And also for us to use this for decision making and data driven and helping us have some good feedback and processes. So I will make the motion to approve this allocation as presented.
Second.
Got a motion and a second. Further discussion. I just want to ask John, did it come out? It came right out.
Right at $16 under.
$16 under?
Yeah.
Great. Okay, any further conversation? Seeing none, hear none. All those oppose the motion, or anybody that opposes the motion. Seeing none, that passes unanimously. Congratulations. Moving right along, Northern Colorado Health Network. As you recall, those are all new contracts for us, but we're kind of working. Now we're bringing up folks we have contracted with in the past, so they're not new faces in that regard. Good afternoon, welcome.
Thank you. I'm Christy Burbaker. I'm the Prevention Service Manager over at Health Network.
Hi, I'm Danny Wellis, and I'm our Director of Behavioral Health and Wellness. And I've had the opportunity to work alongside CHN and their programs since 2007. So we're going to talk about all the spectrum of care we provide.
Just a quick introduction of Northern Colorado Health Network. If nobody's familiar, we provide prevention and harm reduction services to our participants. So we provide safe use for folks that are currently using substances, as well as prevention efforts, so overdose prevention, as well as STI testing, HIV testing, syphilis testing, and hepatitis C testing, which is free to everybody in our community. Before I go over these numbers, I just want to emphasize that these are only half of the numbers that we're actually serving in the community. The other half is actually being reported to another grant. So as we see up here, we have 452 unique participants. In reality, that's close to 1,000. A couple numbers that I want to go over. I don't want to go over everything just for sake of time. We had 215 participants disclose living outdoors. I think this highlights the huge need of outreach as far as supports that are needed and resources to our in-house community. We also had 80 participants disclose reusing syringes in the last year. This also highlights how much of a need harm reduction actually is. However, 397 disclose that they are not currently injecting substances, which also highlights how important harm reduction is. Next slide, please. So these are our dreams and wants of 2025. We want to be able to maintain our hours and locations, which is going to provide consistency to our participants.
Right now, we're only doing outreach in Loveland, so we want to be able to move that into Fort Collins, which involves cleanup. So we go out into the community and clean up paraphernalia that is found out in the community, as well as engaging with our unhoused folks with resources and support. Another hope and dream is to be able to increase training for confirmation testing. So we do hepatitis C treatment within our facility. We partnered with Family Medicine Center. So I want to be able to send 2 of my coordinators to get training in phlebotomy, so we're able to do in-house confirmation testing. Next slide.
The next slide is our expansion, which you all have patiently heard about for a bit. So moving from harm reduction to the spectrum of treatment and access to care. So expanding, so we would go, our behavioral health department would go alongside Christy and her team on outreach, alongside in-house, alongside confirmatories, alongside our Suboxone clinic, and we'd be available for linkage to care and support. And that would allow for access to treatment. And as you all have heard for the last few months, we would have a wellness and leadership component, so we can take good care of our staff, so they can take good care of our participants and clients.
So this is going to be for the prevention team, our budget. So we have a personal benefits allocation, which is going to be for our salaried employees. So those are going to be employees that are directly front facing with our participants. This other bucket, which is at 6,000, is going to be for our biohazard materials. So those are going to be the disposal of used syringes and other things that need to be disposed of. Moving over to the service budget, this is going to be for our supplies that we offer our participants, as well as funds, so we can still be able to provide the testing to the community, and travel, which is going to be associated with extra training and travel for our team. Here's a whole bunch of numbers again. Again, we will not go over all of them. I just want to focus mainly on that upper right-hand corner. We had 125 people reported saved last year from our prevention efforts and handing out Narcan. Another point that I want to focus on is our visits. Last year, our goal was to have 400 unique participants served. In the last 6 months, we've already served 452. So our goal moving forward is going to be at least 600. As well as for our testing, our goal was 300 last year, and we've already done 225 within the last 6 months. In that bottom right-hand corner, that's going to be our overdose prevention services. So with handing out Narcan, we've already almost surpassed that 500, or we have surpassed that 500 goal of last year. So this year we're planning on handing out 1,400 doses.
And this will just be quick. We just wanted to take in the fact that we all kind of think and learn differently. So here's a way to look at our budget. As you all have been so patient with our 4 different asks and different sectors of the funds, we wanted to be clear the harm reduction funds very similar to last year, onto leadership, treatment, and opioid preventing misuse. So then here's our expansion. So again, this is what's new, request into 2025. So you'll see in leadership, we're looking to support Christy's team through her management, my support to leadership and training, our associate director, Izzy, wonderful to run the programs, do the budget pieces, all the things. Wellness and professional development, as you all have heard about, that would be group supervision, consultation, training, professional development, and we have that indirect in there. So that's one pocket, the leadership pocket. We can go on. Here's our treatment pocket. So this will be for our services alongside our prevention and harm reduction department. So we would look to seek to hire. We are calling them an integrated clinical care coordinator. That would be a behavioral health clinical staff to be there with everyone, whether that be an outreach or in-house in SAP or in Loveland. Management, of course, to provide management and good quality supervision. Myself to provide support to that as well, and development, supplies, professional development. We're going to do lack coordination for all hires. And then we'll see a little indirect. And then lastly, this bucket for preventing misuse is intended for honestly professional development and community retention for our intern programs. We work really closely with our school of social work programs and other helping professional programs. And so we work with that. We'd really like to pay them for their expertise and work. And so we'll be providing incentives to do so, training, educational materials. We have awesome flyers and things. And so like we talk about, we need to be able to pay for those services to get the word out, and then indirect. quick walkthrough. Here's our proposed metrics for that expansion sector, which is treatment and wellness. So on the top, you'll see the treatment aspects, which is our touch points. So our encounters. We work on a tiered level basis, as you all have heard us talk about. So tier 1 is our touch points. We are goal for 250. Tier 2 to 4 is really that access to care, moving alongside with someone through the spectrum of treatment based on their readiness. So literally walking someone down the hall to Front Range and trying to be really mindful to get people where they need to go right when they say they're ready, which is why we want the Connect linkage program to occur. And then we've set it for a MAT referrals at that 25, honoring that this will be a new program. And so we're going to learn a lot as we learn from our participants. Then you'll see on the bottom is our wellness and staff development leadership section. So you'll see the goals around professional development, what that looks like for training, wellness benefits of personal understanding the need for support, understanding the need for our own behavioral health care, understanding our need for leave options, increasing resiliency training and mentorship. And then one of the most important things to me, individual and group supervision, consultation, we're not in this alone, and really making sure we can retain our staff by doing the work together. We have some 6-month goals. I'm being quick, being mindful of our next presenter. Okay, thank you so much.
So I think this is what I'm super excited about. We've added a few things onto our service hours. So right now we're in Loveland, and we have been for the last year and a half at Salvation Army, being able to provide supplies to our folks in Loveland that aren't able to get to Fort Collins. Recently, we partnered with Summit Stone. They have an outreach program, Loveland Outreach, and we've been able to partner with them on Thursday. So we actually are out in the community, sunshine, cold, snow, it doesn't matter, we're out. Seeking out our homeless folks, giving resources, giving support, seeing how we can best find and meet where they're at. We haven't changed our staff services. We're open Mondays, Wednesdays, and Fridays. We are open a little bit later on Wednesdays because we do our MAT clinic. So we're helping folks get on Suboxone, as well as our hepatitis C clinic that I talked about earlier. And yeah, that's good.
And we're going to be there alongside. Thank you so much. Questions?
Yes.
Same question we kind of asked for everybody. The expanding at this time. I mean, it's a risky thing right now with all the uncertainty. Certainly celebrate that because there's the need. But just wondering what are the plans to kind of sustain that?
Yes, sustainability is the name of the game. So as you know, our Connect program will be new in this region, but we have been piloting it, modeling it around the state with different opioid councils. And so our plan is to work into program income and billing for services. We do have an outpatient behavioral health program that we are just beginning to bill for, which is interesting. We've always been grant funded. And so now we would move that program through that process as well, while also holding drop-in, meet people where they're at services as well. And this would allow us to begin that and begin the sustainability to that. And we've also been talking a lot about how we're going to sustain in our prevention services around community health worker certifications, which we haven't even dabbled in yet for billing, and then also our peer specialists. Do you want to talk about your teams?
Yeah, so I'm here with lived experience. My whole team has lived experience in substance use and mental health, and we're all certified peers. We're actually working on our certification for prevention specialists also, which would be able to be billed services.
So we're just starting all that processes. This would allow for us to think through.
Just have one quick question on the 125 lives. What is your process for hearing about it? It's probably an undercount, but I'm just also
Absolutely.
do you just ask people?
Yep. So every time we have a participant come into our building for services, we take them into a private room, my coordinators do, and that's one of the questions we ask, especially if they're picking up Narcan, fentanyl testing strips, xylazine testing strips. We ask how they were utilized last, and that comes up. If your Narcan was used last, how was it used? And then that's when we'll disclose that information.
Chris, I see your hand is up. Chris Jones.
Hi, thanks. I don't know why my picture looks really pink, so I'll just stay dark. First of all, I want to thank you for this program. I've heard such good things about it, and with friends at the Salvation Army, and it's so needed in Loveland. That was my question too, was where can you meet with people? I've heard of a personal friend who really needs you, who's homeless. And then how can we refer folks to you? That was my question.
Absolutely. So, just bringing them in, there doesn't need to be a referral process, giving them our hours and our location, and they can come on in and we'll get them situated in whatever services that they need. As far as Loveland outreach, they can reach out to Summit Stone and or us also, and we can meet them where they're at in Loveland.
Great. Thank you so much for today.
Further questions?
Ask if Marshall has any.
John, on all the requests, was that?
So this is gonna get icky.
Oh,
We did not budget anything under C-15, and that's what they asked. Categorize the 90,970, which is connect people to the help they need. We didn't put any in that. We put the 90,000, I believe, in our budget in column B2. In order for that to work, we have to take it out of the 162. I was surprised it was 162 because I remember it being a smaller number last month. And when we were looking at the work papers that Carol left us, that became 162 to balance everything. So I believe that 90,000 was originally put in the B2 budget.
so you're thinking. So my memory is I thought we moved that money into the equity bucket, but I don't think we knew that equity was under B. I think we put it under B2 to.
Just a placeholder.
As a placeholder, right?
But the number I remember last month, it wasn't 162, it was a smaller number.
B2 or not?
It was around 80.
Right, but didn't we have a little extra over in the last meeting? And we had a little bit extra, it was a weird number, and we thought we just, instead of trying to figure it out right then.
Yep.
That last meeting, we moved it over into the equity
That's
bucket and added, and I don't know if that increased it then over.
Well, I think what it is that this was a request that wasn't expected and probably would come from the 162. So if we were to take that out, this would be the 90 that moves over. So it's really, if that 50,000 additional.
No, we're on the row above. Sorry, Janelle. They asked, we expected 443 and they asked for 442. Right, we're on network, right?
We are.
I just wanted to double check. They asked for 137 less than what we expected.
But they're also on line 5. No, that's not line.
That's-
You're looking
So this
at.
was
That's the
additional,
line.
yes,
Right.
the budget-
That's the line.
the budget
Right,
needs-
that's why I said this is gonna get sticky.
Oh, okay.
Yes.
The amount is there, but
The
the budget.
162 is bigger than we were thinking about last week, and I think you're right, that we were sort of doing it really fast on how much was left.
Because I think I made the motion to
Yes,
Just
take
put
it
in
and
there.
put it in.
whatever's left, put it over there.
Because we wanted to have an equity, we wanted to be able to have, to try to, remember, we talked about there were some groups that were, they were disproportionate and disproportionately impacted. That maybe a little bit of money would make, for a smaller group, would make a huge difference. Right, that's like the pregnant one or some of these other things, so that's why we just thought we would wait and not rush it so we could think about this, so.
And we didn't know what would be coming down the pipe, so.
So, Mr. Chair, one proposal is to move some budget from B2 over to C15 to cover that.
What
That's
was-
one proposal.
What was the regional equity, was 90?
That was, I believe it was 80,
80?
but I think it's not exactly right. I think if I'm not sure. I can't figure out why 162 appears to sound like double what we thought last week.
Well, but I think it's because we moved, if you go back to that last meeting, there was about 80,000 over.
Yeah.
Left over, and we were like, we don't want, thank you, Dr. Brooks.
Thank you very much.
Yes,
Any feedback, please let us know. But I think it was around 80,000 that was left over that we're trying to figure out. And so I had just said, let's just move out the equity bucket, put it in there.
That's exactly.
And so that's, because I made that motion, I'm pretty clear that's what it is, so.
Right. We did. So, but in order to cover the 90,000, we got to move budget from another column.
Mr. Chair, do we need to make a motion to continue our meeting for a few
Well,
minutes?
yeah, I'd love to get this piece done.
Well, if we could just make a motion to quickly move, extend the meeting, because we have to.
Yeah, I agree, but I want to make sure we get this done and then we're gonna decide if we're gonna continue the next piece.
I'll make a motion to take out the 90,970 out of B.2 under equity to be determined and move it to C15 for Colorado Health Network.
There's a motion on the floor.
I'll second you.
Motion is second. Any further conversation? Hearing none. Does anybody oppose that motion? Hearing none, that passes unanimously. That moves the money over to C15. We still have the proposal from the Colorado Health Network on the floor.
Yeah, I'll make the motion to approve, accept the Colorado Health Network proposal for 90,970 in C15, 66,990 G, 2,996 or 962, sorry, in H9 and 74,941 in J3.
I'll second that.
Great motion, good second. Any further conversation with that? Seeing none. Anybody oppose that motion? That passes unanimously. Good job. That work? We are already 4 minutes over. Hard work on that. We do have one more proposal. That is the Northern Colorado Alliance that we would need to extend the meeting. I would need a motion on that. And understanding, John, that the Alliance's current contract expires when? Tomorrow.
So I'll make a motion to extend the meeting by 10 minutes.
I approve a second.
We've got a motion to extend the meeting by 10 minutes to 3:44. Does anybody oppose that? No. Okay, that motion passes. All right, Alliance, I do have to make a disclosure that I serve on the Northern Colorado Health Alliance Board of Directors. I am going to excuse myself as advisement from our legal counsel and turn the meeting over to our commissioner, and I will be here when you need me.
Thank you. Thank you. Okay,
Okay,
you are under the time. bar.
I was giving Tom a hard time. I was like, I'm at the end of the agenda, so I know I'm gonna sprint. So for that purpose, I have very simple slides for you today, but please ask all of the questions that you have. But when the council made changes to the approved purpose areas they wanted to pursue, the leadership planning and coordination buckets really spoke to the swaths of work that we do in support from the council. And so really pursuing these 3 bucket areas of care coordination to support people into treatment and peer recovery support to go alongside that. Provider education and community education and stigma reduction. And so with those buckets, really looking at our budget, looking at the landscape, we came up with our proposal for the council. And so to that end, I'm gonna yak your ear off for a little bit more before we start talking about numbers. But with our midpoint report, we were able to give you a picture of some of the work that we were up to as a result of those funds. We started digging in on our final report because it's coming due. Basically tomorrow. But to that end, I'm really seeing a lot of really positive outcomes as a result of the work being done from the council. And to that end, I wanted to just share a little bit of data with you. We do assessment of our folks at intake and at 6 months and then again later. But 37% said they couldn't afford food, 51% couldn't afford insurance, 7% couldn't afford a phone, 65% could not afford housing, 66% couldn't afford transportation, 66% utilities, 82% could not afford childcare. So those are the folks that we're supporting every day. But On the flip side, the positive side, right? World is hard, right? But we still have wins. We're seeing decreases in anxiety, depression, suicidality, improved understanding, remembering, concentrating, focusing, decreases in nicotine, alcohol, marijuana, meth, fentanyl, and heroin across the board, drugs. Reduction in emergency department utilization, improvement in employment and housing and quality of life. And so all of those numbers and barriers aside, we are making change. We're making change. And that's really powerful. So that's just in that first bucket, that care coordination bucket, right? And peer recovery support bucket. I think it's also important to note that 58% of the folks that we serve have minor children. And so that means we've got multi-system engagement often. We're really working to make sure we're supporting the whole family in that time. 39% of our folks identify as a person of color, and 12% speak a language other than English at home. And so really working across our community and making sure that we're providing person-centered support and people have the things that they need to be successful. We do a lot of bridge support in between services. Someone is moving into an inpatient facility. Let's support you in that bridge time. If you're staying at a shelter, let's get you out of shelter so we can get you into treatment. We do a lot of transportation support. Let's work with you, get you to your appointment. I'm gonna be there with you. It won't be as scary. But really making sure that we're keeping people's care continuous throughout their process. We serve as a third-party structure. We're not a treatment provider. People fire their treatment providers every day. I fired my doctor a few times, right? I got a new one. It's a little bit harder in substance use. If you don't like your provider, we're still here. You can still fire us, but it's not the same. So you can tell us about all your woes and we'll still come back and chat with you later. In that provider education space, that really held the rethinking addiction structure. I'm excited to say that we're gonna do it again with the Attorney General's office. October 27th and 28th.
You took my news.
Oh, I'm sorry.
I got you at the end. You took my
Erase that. This is not a recorded meeting.
I was answering the emails and I was like, I was gonna do that to the.
Well,
That's all right, we'll share it.
You can elaborate more for me, but very jazzed to have that partnership at the state and see us be able to come back and do it again. But last year we had 536 attendees, 30 speakers, and 29 sessions. And we had incredibly great feedback come out of that evaluation pre and post. And so very excited for that component. We were also able to engage, I believe the number is 42 people in peer recovery coach training. And so really bolstering that workforce, and that plays very heavily into the new structure that actually we just closed our applications yesterday for a peer recovery leadership program. And so taking people beyond the entry level, keeping them in the workforce and really bolstering their leadership skills to do so. The devastating data point is our peer workforce is in and out within 2 years. That's not leaving their job, that's leaving the workforce. And a lot of that is attributed to our organizations not knowing how to support, our career pathways being limited, and all of those pieces that keep people from being successful and moving up a ladder of command. I got a warning, so I'm gonna speed through here. Community education and stigma reduction. We are in the ballpark of distributing about 6,000 naloxone kits. That's 12,000 individual doses into Larimer County last year. I'll get you the exact digits for the final report, but very excited for that component and Overdose Awareness Day and stigma reduction alongside the Changing Minds campaign with the health district as part of that work as well. So because this budget is all smashed into one purpose area. It's all smashed into one. But I tried to make sure to include a description across here, but we have staffing FTE here for the peer recovery specialist, care coordination, structures, and supervisor. Beyond that, we have Changing Minds campaign, that's a subcontract to the health district. Peer recovery, coach training, subcontract to Advocates for Recovery. Kitchen, speaker fees, equipment, we gotta make sure folks have phones and laptops and an EHR document in, so I can give you those numbers. Client assistance and incentive funding keeps people coming back. If you can't afford your meds, you're not gonna come back, right? We're gonna lose you in the cracks of our system. Rethinking addiction facility, rental, CAS, CAS 2, CPFS enrollment. These are all credentials that we support our staff and staff in the community in pursuing. And program supplies, mutual aid groups, overdose awareness day, rethinking addiction goes into there. And we have mileage to get people throughout our beautiful county. I'm also gonna have you scroll because we threw in a wrench this year. We're hearing in the community all of this uncertainty. We're hearing in the community all of the fear. And in meeting with Thompson School District and a slew of partners, a lot of them said, we gotta show up for our youth and make sure we're supporting them. And to that end, they said, what if we make a Loveland Teen Self-Care Fair? I don't know if you've seen the one in Fort Collins, but it's pretty cool.
It is cool.
But Loveland wants that. And I'm like, yeah, I want to see if we can figure that out. But really, it's with a particular emphasis on making sure our communities that are on that list that's being held by the federal government right now feel safe, supported, and welcome in their community. Having that also trickle into all of smaller events so that we don't just do it one day, we keep learning how to take care of ourselves. Similarly, we're seeing a lot more folks coming through the door. And I anticipate that it's going to continue needing more support than previously needed. And so you heard those data points around access. That second scope item is for that.
We're out of time.
I know. And I was going to talk to sustainability.
Well, that was one of my questions.
Yep.
So, we're over time. Can I get another motion just in 5 minutes for questions? I know we all gotta go, but I think we're doing. I'll second it.
Sorry, team.
Anyone opposed? Okay,
Okay.
5 minutes, but like literally.
Yep.
My question was sustainability because you have expanded.
While also decompressing at the same time.
Right, but you added, so the first 2 grants were expanding access and growing, which was, you bet the numbers, you blew them out of the water, but I'm wondering, as to how you're adding, this is maintaining the full. Sustaining.
Yeah.
So really not an expansion other than the Loveland thing.
Right.
So the Loveland one, it really is, if it's Thompson, can we make it Loveland, Berthoud, and Estes?
Yeah, and I think actually, in talking with partners, we do want to make sure that we're building in transportation support to those communities. And so we have a vehicle that we can use for that, and similarly, the other partners in place do. And so do that, and I want to make sure that folks can get down the hill and back up the hill and downtown.
Well, Loveland is Berthoud and Thompson is Berthoud and also Johnstown, so I just want, and also make sure we don't miss Estes, so.
Yeah.
Any other
And that
questions?
is the list for Estes. From a sustainability standpoint, we did take our original scope from last year and reduced by 19%. And we're also pursuing billable structure with the caveat that a lot of that billable structure is up in the air as well. And so we're holding tight, and it's gonna
That might be a discussion at 6 months.
Yeah.
So offline, I'd like to talk to you about your utilization, because I'm also involved with a project that's looking at that. I'm curious. So offline, love to talk about that. Counselor Black.
Thank you, MJ. I appreciate your presentation. We have kind of been talking about that, a group of us kind of getting a TAC going in Loveland. I know Lori Cliff has hers going on downtown in Fort Collins, and it's really robust. So the family outreach and school board members for the Thompson School District have been trying to have some more robust programming here for our youth. So your conversation with this fits right in with that, with the energy happening right now in Loveland. I'm all for it. I think I attended the very first one in the Armory years and years ago, and it was fabulous. And personally, and as a city council member, I'll definitely be supportive of this coming to Loveland. Thanks for your work.
Appreciate that. I did the first one too, and the last three has been really well
Yeah,
interesting.
it's a right.
So, we're out of time. I will make, I can
We
see
see the, sorry,
Yeah, go
can we
back.
see the, there it is.
Yeah.
So that
So John?
second scope was to look at that equity bucket.
Yeah.
But again.
To clarify, we expected 450 from them. They asked for 500 and 500. So that's 50, the red shaded cell is the more than we expected. However, we still have budget to cover it, but it takes up the extra we have.
Well, I'd just like to wait till the end.
I feel we're under pressure right now. I'm okay.
Sorry. I was just gonna make a pro, you could approve the 450 and we
Yeah.
can deal with the 50
That's
next
what I was
month.
gonna put
That's-
the
I'm
motion
sorry.
to approve the 450
Yeah,
and reserve the appropriate timing to look at the other.
yeah, that's what I was hoping you would. So
Yeah.
there's a motion, is there?
Would that be then just next time when we look at all the others?
Yeah.
Okay.
Yeah, at the end of the round.
So then the contract for that would start later.
So the 50, the
Yep.
recovery, which that 50/50 would be the one we'd have to come back and discuss just to keep the 450 in there.
Right.
That's right.
So would you make the motion specific to J3, the 450?
Okay, I'll make a motion to approve the 450 under J.3 and revisit the 50,500 under B2 at the end of the session.
Any further discussion? Anybody opposed to that? Yes, that's what. Okay, congratulations. Okay. So real quick, I'll just share that, yes, the DAG's office and the Director of Opioid Response was so pleased with the conference last time and the expansion. That they are coming to Loveland. They emailed me last week or over a week ago. It's October 27th is the Opioid Abatement Conference, and Tuesday's Weekend Addiction. The reason that it's not closer to September like it usually is because the ranch and Embassy Suites are so popular, it's hard to find dates, and so just put that on your calendar. And yeah, so really excited, and October 27th.
Cool.
So
Motion to adjourn?
I'll make that motion.
Second.
Got a motion second. Anybody oppose that motion? Hearing none. We adjourn. Great work, everyone.
Congratulations. Mark, great to see you. Thanks for being here. Part of this, the health improvement and the speaker, I had a government board meeting for the